Yo, 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 we back
What
once
up?
again.
Yeah. We on air?
We live.
We good? Live. Let's make it happen then.
All right, for sure. Back once again with Going Viral. I'm Shamari.
They call you Show.
They call me Show, and that's for show.
What's up? I'm Chrome.
And they call him Crow.
Chrome. They call me Chrome.
All right, well. All right, we're going to jump right in, y'all. Let's just jump right in.
Yeah, let's just talk about it.
First of all, I got to let you know we broadcasting live from Noah Free Clinic here at 5620 Ames. Right. So you can call us and schedule your appointment for any type of health screening, 402-933-07.
It's right behind us on this sign, if you forget.
There it is,
933-0737. Yep.
All right, so, man.
It's so much to talk about.
It's so much to talk about. Let's get into it.
It's so much to talk about.
So what we been up to? Let's talk about what we've been up to.
What I've been up to?
Yeah, what you been up
to?
No, what you been up to?
What I've been up to is my business.
Okay.
What you been up to? All right, man. Basically, what I've been doing, man, I've been doing a lot of just paying attention to all the things going on in the community, dealing with a lot of stuff personally, and just trying to stay as positive as possible through these trying times. We got the kids going back to school, and we got the virus spreading and community spread going on a lot. I've seen a lot of that, and it's just been a lot I've been paying attention to and focused on, man. What about yourself?
Man, speaking of community, I've been working with the Step Up internship. We got 4 youth who have been, they're really tremendous youth. I think they represent themselves well. They represent their families well. Getting, job training here at Noah Free Clinic, they're learning about the health career field. They're learning about the human anatomy. They're learning about, disease, preventable disease. And so we're trying to get them in early and educate them. So I think we got some photos and a brief clip we want to show you here.
So the vein's taking it back to the heart. Which part of the heart is the blood going to go in? We already hit the right side. Left atrium, that's right. So.
That's cool. That's the Step Up program, right?
Right, that's the Step Up Youth Program. I said, they've been learning about the cardiovascular system and learning about the respiratory system.
That's cool.
And the diseases that go along with it. So it's important that they get a good grasp on that.
Well, make sure you teach them right then.
Teach them right. So what was you doing this weekend?
What I do this weekend?
Yeah.
What did I do? I can't remember. I do too much. I just do it. I just bam. I'm just going. Bam. Did it again.
I heard you was over at Clare Methodist.
You get out of my business. No, I was over there, man. We did COVID-19 testing. Free testing over there at Clare. Actually, I think it might be something going on this weekend. It depends on if we get these tests. If Douglas County gives us more tests. We tested 90 people.
Wow.
90 people came through to get tested, man. It was, you pull up, bam, they stick the thing right up your nose.
Quick and easy?
Yeah.
It was quick and easy?
It was quick and easy.
All
Bam.
Right. That's what's up.
Yep.
So, yeah, man, I think we got some photos of this weekend at Clare Methodist. Shout out to Pastor P. She was there directing traffic.
Yeah,
she's very involved.
I was directing traffic too.
You was helping direct traffic.
Yeah, I was
as well.
directing traffic too.
All right. I ain't coming for your traffic directing skills.
I'm just saying.
All right.
Get it twisted.
And that was sponsored by Noah Free Clinic as well as UNMC have volunteers there. There's a lot of test sites here. So we encouraging folks to get tested because as of July 10th. There were 20,777 cases in Nebraska. And over the past week, so from July 3rd to July 10th, that increased. Are you yawning right now? Are you tired? You need to get some rest. You old boy. All right, and so over the last week from July 3rd to July 10th, over 1,000 cases.
Over 1,000 cases?
Over 1,000 new cases in a week. And
in a week?
Yeah, in a week. So some of this is due to the increased availability of testing, but it's just something, you know,
Right,
we're
right,
monitoring as a community. We got to monitor that community spread, and you know, we do need to let you know that there have been 286 COVID-19 related deaths since they began testing earlier in May. So it's a real thing we're dealing with. But you should know that 15,000 of those cases have recovered. Over
Yep,
15,000.
Over 15,000. I seen that. Yep, I did see that.
Yeah. So, you know,
I think it's important that we share the cases that have recovered, the people, because all we hear about is death. You know, it's kind of traumatizing, you know, to just keep hearing people dying, and it keeps you paranoid, you know. Of course, take precaution. Of course, wash your hands and do the social distancing and pay attention. But know that there are people who have recovered from this, and yeah, it's not all about death, man. But I can't stress it enough. Still be cautious. Still protect yourself, and don't think that everybody's gonna make it through this crisis, you know.
yeah, we got to fight to live. We got to do what we need to do
Got to.
as a community. I mean, we've been needing to, you know, work on our public health as a community anyway. So this is just, you know, one more hurdle that we got to get over right now.
You see this beard right here?
What beard?
The beard I grew, man.
We just talking about that little chin strap?
Man, I'm catching up.
Man,
to
this a beard.
Man, look at this. Boy, you don't know nothing
That's a
about that.
beard. That's a beard. We ain't gonna give you the RD.
It's a beard.
It be.
Who?
It be.
Oh, I can't get the
You can't get the-
BEARD.
You don't get no RD.
I get a BEA.
Yeah. There you go. So check me out though.
Yeah.
Real talk, man. Hot topic right now. OPS has released their guidelines for returning to school here in the fall. Even amongst COVID-19.
Man,
What's your thoughts?
what's my thoughts, man? I'm just as confused as every other parent probably is, man. You know, I got 3 kids in school, one headed off to college. And it's like they're talking a certain amount of kids per classroom, you know, wear masks, couple days a week and all this. It's just like, for one, it's so confusing because they keep sending email and they keep switching it and having to switch it and adjust, and you know, it's hard to keep up with, you know, and it makes you be like, dang. Just like anything else, when somebody ain't got their stuff together, you like, should I go to that concert? They ain't even knowing for sure if they gonna be there. You know what I'm saying? You don't know what's about to happen or what you're in for, because things keep on changing and changing. So it's just like, I've had enough. You know what I'm saying?
Yeah, we in for it right now as a community, because on top of, you know, the things we already deal with as a community, as far as making sure our youth are getting a solid education, you know, right now we dealing with a whole pandemic on top of that. So what it's going to take is a lot of engagement. You know, parents, you're going to have to we're going to have to be up at the school more than ever. You know, we're going to have the teachers on speed dial, have the counselors on speed dial, the nurse. You know, we got to really over engage just to get on track as a community and be informed as possible.
Yeah. You got to. And you know, I don't like that the parents can't go into schools. I understand, you know, they don't want anybody from the outside just walking in and whatever. But it's kind of tough, man, when you want to go in there and pop up. Think about when you want to pop up and it's your kid's birthday and you want to bring your kids gifts and all this. It's just tough, man. It's going to be a tough school year for the kids, and it's going to be a tough school year for the parents. And all we can do is sit back and wait and see what's going to happen next, where we're going to go from here, man.
Yeah, definitely. So we're encouraging you to reach out to the school board members, find out who represents you, whatever school you go to, because they're going to be your direct line of contact to the superintendent if you have your concerns and whatnot. So
Right.
you know, we're gonna be praying for our youth as they return, and our teachers and the staff and everybody, you know, our whole community. So something we need to look out for. A lot of people wonder what we do at Noah Free Clinic, and you know why it's important. The work we do is important, and we as black men are employed at a place like this. It's because, Man, we are really facing health disparities at an unreal rate. And you work with a program that deals with this.
Yeah, the Wise Man program, and what I deal with is ages 12 through 25, and it's just we worry about the COVID-19, but in the midst of it, I think that there's a lot of STDs that are not being paid attention to, stuff that's not being paid attention to. We're so worried about the COVID-19 that we forget that there's other diseases out there, such as HIV. Did you all know that statistically, last checked, there was, what was it? It's 74. You know about this stuff too. It's 74% male, and what? The other 26?
I got you right here. Look, black males from 2014. It takes a while to collect data. But according to Douglas County Health Department,
right,
in 2014 to 2018, black males represented 74% of new HIV cases.
Black males,
black men,
and that's what I deal with is black males and getting guys in to get tested, and it's tough because that just shows that black men, black guys need to come in, get tested, pay more attention to your health. It's happening, man. It's happening. It's happening at a rapid rate. Those numbers are ridiculous.
Right.
It's ridiculous. It's ridiculous whenever you get numbers that say, hey, someone has HIV. But to see the stunning number and the stunning percentage of black males, encountering this disease, getting diagnosed with this, it's overwhelming. And it's something that really needs to be paid attention to.
Well, black people averaging 21 HIV cases per year, 26% of those being new HIV cases, but black people only represent, and that's in Nebraska, right? 26% of
12% or something.
26% of new Nebraska HIV cases are black people.
Right.
But black people only represent about 5% statewide of the population.
That's sad.
That's very crucial. Weird. That's critical, and that's something that we should be mindful of. So, but our message to the black man: wake up. We gotta do better as black men. We gotta be more mindful. We gotta take care of ourselves.
Be more responsible.
Love
yourself.
Right.
Love yourself enough to love others. Because when you're not loving yourself, you're going out there and you're being reckless, and it's affecting our whole community, our whole culture, and it's only making it bad for everybody else, including yourself. So what you do, your actions, and how you protect your health and your well-being is how the world and the community is going to protect their self and well-being. You're one person, but you make so much of a huge difference, because with every person that's diagnosed with an STD, a disease, high blood pressure, whatever, there's somebody else who's conducting their lifestyle just like you, and it's just going to keep going on. It's a cycle, and we're just going to be a statistic. We're just going to be a number, and people are actually dying from these diseases and things. So
yeah, and it extends beyond just the young black men as well, because this sign, as you see, it says free cancer screenings, because as we know, prostate cancer is very deadly for black men. One of the reasons is they don't get checkups.
You know what I want to do?
What's that?
And it just popped in my mind. This don't got nothing to do with what we got going on. I want to take a moment of silence. A very important figure in the community passed on. This is a guy that mentored many, helped many, and he looked out for a lot of black men in the community by uplifting them, giving them books to read, telling them wisdom and knowledge, and just being a father figure, a grandfather figure to many. So I want to just take a moment of silence for Brother Marshall Taylor of the Afro-American Bookstore. He passed on, and I want to make sure that his legacy lives on. So while we're on this podcast, that popped in my head, and I'm going to take this moment of silence.
Great. All right.
Thank you.
Appreciate that, bro.
Yeah,
Yeah,
know
man.
it. You know it.
Brother
That's my
Taylor.
God, man.
Yeah, man, for sure.
Yep.
So, man, that's a great place to end, because you know what, even in the midst of all of our struggles, be it with law or with health or with government, whatever it is, our struggles, we have some solid elders and some solid young people, just black people in our community that do great work. And so
we gotta appreciate them while they're here.
That's
man,
right.
And really take heed to the things that they're saying. I realize that me personally, I'm in that age to where people look up to me, and if I'm giving out bullcrap information, and if I'm feeding the people, stuff that they can't use in life, then I'm not doing my job as an elder in the community, as an experienced black male in the communities, to uplift the people who still might not be there yet.
Right. So, hey, I'm Sho.
And I'm Chrome. Y'all know who I am.
Hey, look, we just trying to give you some news you can use, Omaha.
Some news you can use.
Yeah, and around the world. So, y'all take it easy. Y'all be careful and be mindful out here. Socially distance, do what's necessary, and we're gonna be all right.
And you got to put that stuff at the bottom of the screen that be going across like
that little bottom thing.
We go.
Yeah,
it gives the address, the number, and we're still appointment only. Up here at Noah Free Clinic, 5620 Ames Ave. It's right here on the poster behind us. Come in, get tested. We do more than just STD tests. You can come in here and get a physical for back to school, and whatever else you think's going on with you, your health needs. Come through here, and if we can't do it, we'll refer you to the proper person who can handle it. But guys, black males, white males, whoever, females, all people, just people, come in, get tested, handle your business, be responsible, and we gonna sign out.
Yep.
Right? I ain't got nothing else to say. You got something else to say?
Nah.
Your peace sign up, so I'll do that. Bam.
Peace.
Peace.